Good morning, dear colleagues. Today our topic is hypoxia. So we'll cover this topic under the following headlines: introduction, types and causes, effects, features, and treatment. Now, hypoxia, what does it mean? Hypoxia means oxygen deficiency at tissue level. Anoxia means when there is a lack of oxygen in the tissues. There are four categories of hypoxia. One is hypoxemia, one is anemic hypoxia, one is ischemic or stagnant hypoxia, and one is histotoxic hypoxia. Now, condition of reduced arterial PO2 is termed as hypoxia. Problem is in normal individuals at high altitude is the most common form of hypoxia. Inadequate oxygenation of blood in lungs, that is decreased PO2 in the inspired air, hypoventilation, that is decreased ventilation, pulmonary disease causing impaired diffusion of oxygen, ventilation perfusion mismatches because of various causes, venous to arterial shunt as per his congenital heart disease like tetralogy of Fallot. Now, anemic hypoxia causes is reduced oxygen carrying capacity by the blood, anemia or normal or abnormal hemoglobin, poisoning by carbon monoxide. These are the causes of anemic hypoxia. Now, how it happens? Hypoxia due to anemia is not severe at rest unless hemoglobin deficiency is marked, because 2,3-DPG increases in the RBC. Hemoglobin level is normal, but increased abnormal hemoglobin as per carbon monoxide poisoning or methemoglobin can also cause anemic hypoxia. Ischemic or stagnant hypoxia is also known as hypoperfusion or ischemic, general circulatory deficiency, localized circulatory deficiency. Due to sluggish blood flow, arterial venous difference increases, stagnation of blood in capillaries for a larger than normal leads to greater oxygen extraction. Histotoxic hypoxia is utilization by tissue is reduced, poisoning of cellular oxidation by enzymes, most commonly due to cyanide poisoning. Cyanide inhibits cytochrome oxidase, arteriovenous difference markedly reduced. Methylene blue or nitrates are used to treat cyanide poisoning. Features: hypoxemia is a peripheral chemoreceptor stimulation. Anemic cyanosis is not seen. Stagnant peripheral cyanosis is a prominent feature. Histotoxic cyanosis is not seen at all. This is the peripheral cyanosis picture. This is a central cyanosis picture. What are the effects now? Hypoxia causes production of transcription factors like hypoxia-induced factors like HIF, depressed mental activity, reduced work capacity of the muscles, if severe can cause death of cells. Now these are the various effects of hypoxia which is depicted by this chart. Go through this, visualize this properly, and then you can see that low oxygen pressure at high altitude, the carotid body, a cluster of specialized cells in the carotid body, detects low oxygen levels in the blood and alerts the brain. In response, the brain sends signals to the rest of the body to increase breathing rate, constrict vessels in the lung, increase the heart rate, dilate peripheral blood vessels in arms, legs, hands, and feet. Now, treatment is by oxygen therapy or by hyperbaric oxygen. Oxygen can be administered by placing patient's head in a tent that contains air fortified with oxygen, allowing patient to breathe either pure oxygen or high concentrated oxygen from a mask, administering oxygen through an intranasal tube. Now this is the picture of a oxygen tent, facial oxygen tent. This can be given under normal atmospheric pressure. Pure oxygen tolerated by patients can be 8 hours maximum. 8 or more than 8 hours, pleural effusion and edema can occur. Other tissues not affected because of HbO2 buffer system. In hypoxemia, oxygen therapy can be completely correct due to depressed oxygen level, provide 100% effective therapy. In anemic hypoxia, oxygen therapy moderately effective for about 70%. In stagnant hypoxia, effectiveness of oxygen therapy is less than 50%. And in heterotoxic hypoxia, oxygen therapy is not at all useful. Hyperbaric oxygen is administration of oxygen at 2 to 3 atmospheric pressure, that is more than the atmospheric pressure. This can be tolerated for a period of 5 hours. Oxygen toxicity if given for a long time. In carbon monoxide poisoning, it is very useful. Treatment of gas gangrene can be done by this. Thank you. I believe you have gone through the slides. You will remember the vital points of the effects, the treatment, the causes, and the variations. Thank you.